Problem is the low thyroid is not picked up, even though testosterone is not either, but is not picked up on standard blood tests. So they miss it. Now you look at weight loss, giving like Synthroid, Levoxyl, you can get maybe a 5 to 10% increase in metabolism. When you give T3, you get a 20 to 30% increase. So a study by Jonathan Wright, and he put a little probe inside the cell and looked at the T4, which is inactive thyroid, to the active T3 conversion. Normally it was about 60%. If you fasted, didn't eat anything, it went down to about 50%. In diabetics, it was 25%. But the standard blood tests look normal. So what it is, it's hypometabolic inside the cell. So T3 for type 2 diabetes, significant increase in metabolism, and then you usually get your weight loss. Testosterone also, you look at the studies on testosterone, low testosterone, significant weight gain. Give testosterone and significant weight loss. Studies showed one giving testosterone and growth hormone in 6 months doing no diet or exercise, men lost on average 14% body fat and gained 9% lean muscle doing nothing. So very powerful. Yeah, we could talk to Stephanie about it. Is Stephanie here?
No, she ran out.
She left. She left us. But no, we have appointments. I think because we keep slots open. You can get in a week or two. I believe yes, you should. When you're deficient, you just want to bring them back to healthy, youthful levels. There's no reason to stop. Yeah, we do. We have periodic, definitely. Everyone's different. There's no set regimen. Everyone needs different amounts of blood tests and different periods of time, but certainly. Yeah, there's a review, kind of a summary of the PowerPoint presentation with all the studies showing the difference between bioidentical hormones. Also a lot about thyroid and testosterone for men, growth hormone, chronic fatigue syndrome, fibromyalgia, all those things. Yeah, I mean, they've been, they were one of the first things synthesized. But then when the money came into into medicine, hey, we can't patent them. Then it switched over. Yeah, the only difference with the lectures to doctors, I kind of dumb it down. So make it a little easier to comprehend. No, but yeah, we're planning to. Yeah, we may also do. Would you guys be interested in about thyroid lectures also? Okay. Yeah. So that may be. We'll probably do some other ones, testosterone for men, a lot of other things too. Yeah. We are, especially for chronic fatigue syndrome. We have an outcome database. We plug everyone into the computer to make sure everyone's progressing, and we look at all the data. So the plan is to publish those. Yeah.
Would you recommend going on?
Has issue with going on hormones for someone who's 78 with issues of osteoporosis? Absolutely.
There's a question about men with osteoporosis. Testosterone is the most potent bone-building hormone that the body has. So it works for men and women. But
yeah, if a man is osteoporotic, it's almost impossible he's not low testosterone and/or low growth hormone. Again, it's the same controversy about human growth hormone, and it's ridiculous. There's no study to show it's basically harmful, and doctors will call and say, well, why'd you put them on? We don't know the long-term consequences. I said, well, I have 40 years of studies. There's over 2,000 long-term studies. What's the longest study on Lipitor? 4 years, and it's controversial for people who don't do it, and they just say, oh, that's, And one big problem with growth hormone, you hear what causes cancer. It makes cancer grow. But because it sounds reasonable, it's growth hormone. But actually, no study, it's actually the opposite. They give it to AIDS patients, approved for AIDS patients who have cancer everywhere in their body, reduce their cancer. And actually, this was addressed in the Journal of Endocrinology and Metabolism. The editor wrote a review article and said, why does everyone keep saying this? And I think you hear it a lot on the internet because people sell these sprays and stuff. And they say, oh, don't take the shots, it causes cancer. Ours doesn't, So I think it's a lot of misinformation. I think there's really, the controversial, is just misinformation. No, there's no cream for growth hormone. It's too big of a molecule to absorb. It's bigger than insulin. We've been trying to do creams and sublingual insulin for years and years. So you may be thinking of TransDtropin. We get so many products, and we've tested literally hundreds of them that claim boost growth hormone levels, and we check the levels, and they just don't work. Typically, we use the shots. That's the only way to get the effect of growth hormone.
Real growth hormone.
Yeah, actual growth hormone. No, it's much cheaper now. It came off patent about 2 weeks ago, so it's dropped significantly in price. It's about a couple $100 a month. Well, you do the shot every day, or you can do it a couple times a week, and very tiny injection. Yeah. Yeah, we have the growth hormone in the office, and the big problem is that it's Zevon 60 Minutes, the most counterfeited drug in the history of pharmaceuticals. And we have people go down to Mexico and get it, and they end up in the hospital. So that's the problem with it, but because that's in demand.
As we were up here, we were just chatting amongst ourselves, and I'll just share another thing about myself, and that's that I was a marathon runner for 25 years, running about 8 miles a day. When I got injured a little over about 1.5 years ago, I gained about 15 pounds. I found my blood pressure went up, my cholesterol went up, my triglycerides went up. I was having trouble losing weight around the middle, and some of the tests showed that I was pre-diabetic. And I checked all of this stuff out when I first met Dr. Holtorf. And I also had a condition like Raynaud's phenomena. I enjoyed my coffee in the morning, but my hands would be so cold when I would touch patients. They would absolutely jump. And I even bought a jacuzzi and jump in it 3 times a day just to get warm at times. Since I started on thyroid, my cholesterol is coming down. I don't have the same symptoms with Raynaud's, and a lot of this is improving. So it's just fascinating stuff.
Well, thank you very much.
It's not any better in the rest of the country.
Yeah, and that's the problem is that you expect, hey, it's medical care. I go to my doctor, he's going to know everything. But unfortunately, that's not it. But you should give yourselves a hand in being basically proactive and trying to find out what's the best for you. And unfortunately, in the United States and other places in the world, you need to be proactive. There's no one that's going to basically be responsible for your health care. You're going to have to be responsible for it. Well, thank you, everyone.
Thank you.
I appreciate it.